This is one of those national registry style questions that a lot of students mess up. Let's dissect it. First, we're going to go through a scenario, and then we're going to pull two questions from that scenario. A 22-year-old male is playing in a recreational soccer game when he collides with another player and falls hard onto his right side. Bystanders state he got up immediately, but began complaining of chest pain and shortness of breath several minutes later. On arrival, the patient's sitting upright on the sidelines, anxious but alert. Heart rate's 126, blood pressure's 136/86, respirations are 26, and the O2 sat is 91% on room air. Let's pull two questions from the scenario, but I'm not going to give you the answers yet because I want you to try to figure it out without having the multiple choice. Question number one, what is the most likely condition affecting this patient? What do you guys think? And question number two, what's the most appropriate treatment for this patient at this time? Now let's look at those answers. So for question number one, we got A, a simple pneumothorax, B, a tension pneumothorax, C, a pulmonary embolism, and D, cardiac tamponade. And for question number two, we got A, assist the ventilations with a BVM using positive pressure ventilation, B, administer high flow oxygen and closely monitor for deterioration. C, apply CPAP and improve oxygenation and reduce respiratory effort. And D, place the patient supine to improve their ventilations. Every day we break down a different difficult national registry question and dissect it. We do it using this 4-step method. So here's the 4-step method that you can use whenever you're challenged by a difficult question. Step number one is recognizing the clues. So let's take a look at what clues we have available to us. The first clue is that he falls on the right side, which means the chances of an injury to the heart are pretty minimal. And we know that the patient has chest pain and shortness of breath. But here's the really big clue, the vitals. We notice that heart rate is elevated, but the BP is really normal tensive. But the respirations and the pulse ox make it pretty obvious that this patient's hypoxic. Now, the biggest clue we got in this scenario is the normal blood pressure, and I'll get to why. But we also have an elevated respiratory rate and a decreased pulse ox. And then we have the mechanism of injury. And there's a pattern here. So the patient has a pneumothorax, and I'm sure a lot of you already know that. But how we get there, regardless of whether you knew the answer to this question, is the most important part, because that's what this video is about, is dissecting the questions. Because even if you guess pneumothorax, you still have a chance of messing this question up. Now, there's two types of pneumothorax. There's a simple pneumothorax and a tension pneumothorax. And this is a simple pneumothorax. Let's break down what's going on. In normal breathing, we use negative pressure to draw in air, but when we have a collapsed lung, you can't generate that negative pressure, so no air is going into the lung. Now, believe it or not, simple pneumothoraxes aren't an immediate life threat. Yes, they need addressed, but those patients aren't typically your critical patients, unless we make them one. And this is where registry gets a lot of people. So you see, with the simple pneumothorax, there's just less area for gas exchange, but the patient can still get enough oxygen on board, which is that normal negative pressure. So why is that a problem, and how does registry trick people with this question? Well, for that, we need step number 3, which is eliminate traps. Now, a lot of what registry relies on is you, as the test taker, saying what if. Saying what if is adding elements to the scenario that aren't there. And a lot of people think National Registry is tricky and they're throwing extra stuff in there to throw you off. They're really not. If there is a clue in the scenario, you can take that clue to the bank. Now, because of this elevated respiratory rate and that low pulse ox, a lot of people would be tempted to ventilate the patient. Because in most scenarios like this, that's what we would do. But if you were ventilating the patient with positive pressure ventilation, you're pushing air into the lungs and it's going to end up getting trapped there. So you turned your simple pneumothorax, something that's not immediately life-threatening, into a tension pneumothorax, which is life-threatening. So whenever we provide that positive pressure ventilation to a simple pneumothorax, we're creating a tension pneumothorax. Now, how do I know it's a simple pneumo and not a tension pneumo? Well, it's that blood pressure. A tension pneumothorax is life-threatening because it smashes the heart and lowers the amount of blood flow that can get to the heart and from the heart, which decreases that blood pressure. Now, in the real world, you're transitioning from a normal blood pressure eventually to a hypotensive blood pressure. But in the testing world, you're either going to have a normal tensive or a hypotensive patient with an obviously collapsed lung. So for question number 1, we decide simple pneumothorax, and we do that because we have a normal blood pressure. And for question number 2, we know that we need to administer high flow oxygen, but not that positive pressure ventilation. Now, if you want a new question broken down like this every day, check the links in the descriptions, and until next time, be safe.